including being its president during 1994 and 1995. He has been very active in the American Cancer Society, both on a state and a national level, and serves on the national board of the American Cancer Society. He is the recipient of the National Bronze Award, which is the highest award that the Society gives to its volunteers. He's been very active in community and state health care issues, focusing on domestic violence. He's been appointed by the American Bar Association Committee on Domestic Violence, and he serves as an advisory on the advisory committee to the Attorney General and the Secretary of Health and Human Services. Dr. McAfee is a native of Portland. He and his wife reside in Portland. They have 4 children. 2 sons, one an attorney, the other a doctor, and 2 daughters, one who is with Blue Cross and the other who is a school principal. On a personal note, I can tell you that I've known the McAfee family, his father and mother, and his brothers for almost 30 years. They're a wonderful Maine family. Please join me in welcoming Dr. McAfee.
For that very gracious introduction. And I also thank you, members of the Portland Rotary, for inviting me back again. I've had the marvelous opportunity to speak to many Rotary clubs around this country, around the world. But rarely have I been invited back again. And I thank you for that. As Naj said, I did have the marvelous opportunity to be president of the AMA, the world's largest organization of physicians, during a very fascinating time, a time when the Clinton Health Plan was before this country, and people forget there were many other alternatives that we needed to address at that time, but unfortunately focused only upon the president's plan. I'm sorry that we did not begin at that point the incremental changes that were necessary to improve this healthcare system. We still will have that opportunity. But I guess my legacy is 14 times in the White House and not once in the Lincoln bed. I now know what I was not doing right. When you become the past president of the AMA, it's a lot like the fellow who runs the cemetery. You still have a lot of people under you, but no one listens anymore. When I say that I have spoken to many Rotary clubs, I will tell you that I have been many in this state, in this region. I've been to the Jackson, Mississippi Club, which I guess is one of the biggest, kind of huge. I mean, it's massive. But I've also been to Honolulu. We've done the Honolulu Rotary Club. But I've also made 2 presentations in Japan, one in Tokyo, one in Yokohama, to their Rotarians. I have enjoyed each of those occasions. I will tell you, having also spoken to Kiwanians, elk, lions, that you are by far and away the happiest group to address. I always have this image that if John the Baptist were to walk in the door at this moment, you would all stand in unison and say, "Hey, Jack." My dad had polio. He had it as a young teenager. It left him with a withered right leg, which changed his life. He loved baseball, he was a great pitcher, but from that point on, through his 4 sons, vicariously enjoyed sports and athletics. He was otherwise well and otherwise recovered and had no other manifestation as a residual of that disease, which was far too common in the state of Maine, where he came from originally. I, as a native here of Portland, remember very well the New England epidemics of 1949 and 55. They were major, frightening epidemics, probably the likes of which we have never seen since, including the concerns we have about HIV and AIDS. And I remember how it influenced your daily activity and how your parents cautioned you not to go into the swimming pool, or even to the lake, or even to the seashore, where there were areas of congregation with others who may have the disease, and we weren't sure exactly what your risk was at that time. And so when the impact of the Salk vaccine came aboard, where you suddenly had the opportunity to prevent for your children this devastating, disabling, and for many, life-threatening disease. The impact of that vaccine probably was unequaled in the history of this country. Unfortunately, there were many who did not take advantage of it for a variety of reasons. And when I graduated from medical school and began my internship at the Maine Medical Center in 1960, in July, I participated in the care of the very last patient admitted with active paralyzing polio, a 10-year-old boy who lived in this community and whose parents did not believe in injections and vaccination. And I will tell you, sitting at the bedside, armed with nothing but the suggestions from Sister Kenny of warm packs and hydration and sedation and careful monitoring, you were frustrated as you saw the ascending paralysis starting in a leg, going to a thigh, going to the abdominal muscles, putting the iron lung outside the door because if you needed it by morning, the child had to be in that because you didn't have respirators in those days. And the green iron lungs, which for many years still were there at the Maine Medical Center, are now in a storage vault. Most have been destroyed because we can provide respiratory assistance much easier. But the ominous machine sitting outside one's room always conveyed to you the sense of frustration. It was an important educational tool for you as a physician to understand that just by being there and holding a hand was perhaps the most that you could afford that patient. And when suddenly there came upon us the vaccination programs, and from that secondarily the improvement to the oral vaccine, we could see the elimination of that disease in this country. I can't tell you the impact of that on my professional career, and I know on many of you who have been natives of this community for a long time. Unfortunately, there is a risk from the oral vaccine because it is a live attenuated vaccine, and for some individuals whose immunology we still have difficulty in identifying, the vaccine itself can cause significant polio. And a very familiar case to me is that of a colleague of mine, a pediatrician in Dover, New Hampshire, whose grandson developed bulbar polio as a result of the vaccine itself. The whole process of the Vaccine Compensation Committee and our re-looking at the vaccine is one which has followed. And so we have returned to the recommendation being that of the injectable vaccine, 4 shots for youngsters, for newborns and young children, is the most effective way to maintain an immune population in this country. The oral vaccine, however, because of its cost, which is cheaper, its ease of administration, and its availability, remains the global standard by which we must continue to eradicate this disease. I will make just one other comment about a dear friend of mine who is one of my heroes in medical school, Dr. Louis Weinstein. This was his obituary in March of the New York Times. He died at the age of 92. Probably the father of infectious disease, certainly in this part of the world. The only individual I knew who had, in his lifetime, major teaching appointments at all 3 medical schools in the Boston area. He developed infectious disease. And when the HIV/AIDS epidemic was occurring, many of us in the profession were embarrassed by some of our colleagues in medicine and in dentistry refusing to treat patients with AIDS for fear of contracting the disease, when it was perfectly well known that risk was essentially zero. We thought that was the first time our profession had turned its back on patients. And yet I was fascinated to read in Dr. Weinstein's obituary, and I quote to you, that he was a heroic figure in the polio epidemics that paralyzed many people in New England in 49 and 55. Appalled that many obstetricians refused to treat pregnant women with polio for fear of contracting the viral infection, Dr. Weinstein delivered the babies himself. Those indeed were, fortunately, distant days and distant memories. But for many in the rest of the world who still suffer and live in endemic countries, the same tragedies from that disease exist. I have been fortunate to be a consultant, and still am, to the World Health Organization, as well as to the Centers for Disease Control, particularly their Injury Prevention Division. I've worked with UNICEF, but I will tell you, your 3 partners in this endeavor nationwide, with Rotary, tell you that this country's inability to pay or refusal to pay its UN dues. Many people forget that this is where the WHO gets its contribution from this country. And that money was not made available, at least to the degree necessary, to do a better job than we have in the past. So when you go to Geneva and sit down with your colleagues around the world, the fact that you come from the United States, whose country does not feel, even though it has the resources, compelled to assist in this endeavor, a moment of frustration. Without the contributions of U.S. Rotary, I think the image of our country would have suffered substantially. And it's because of your efforts filling in those gaps has there been a continuing worldwide organization which will make it happen. We must eliminate the wild virus of polio from every country. Because as long as it exists in any one country, we are all at risk for that disease, despite our immunization. Polio has been eliminated from the Americas, from Europe, from the Western Pacific region, and from great parts of the rest of the world. We have continuing needs, however, for massive immunization programs, as well as laboratory facilities to identify the virus, to measure it, and to assure when it has left the populations. The National Immunization Day programs that your dollars and your volunteers go to support are amazing. In countries that are at war, particularly in the African continent, Sierra Leone, the Congo, Sudan, Somalia, National Immunization Days are established, are planned, and hostilities cease for the day. We stop war for the day while hundreds of thousands of children are immunized. The next day, the war continues. But the cooperation of those countries with the pressure of the world has made it happen in ever-increasing numbers. And so what was felt to be a totally impossible public health task has turned out to be very doable and very achievable. The fact that Rotarians volunteer at the clinics, help administer the vaccine, work in the labs, help with the paperwork, provides an immense service that cannot be duplicated in the rest of the populations that are there. 1 million Rotarians, 1 million Rotarians have participated in this effort. 3,151 clubs, 366 regions. And now the most difficult times occur. In Southeast Asia, particularly in India, the country with the largest incidence of polio now, along with Bangladesh and Pakistan, have shown great strides but still have a huge endemic pool of the wild virus. Southeastern Turkey and the Eastern Mediterranean continue to be areas that need a special attention. And I've already mentioned the difficulty in 7 countries in Africa. It will be difficult to eradicate the rest. It'll be similar to the census, because once you've had the major immunization clinics, you then must follow this up with a door-to-door visitation program. Because if you leave one family, one street, one community, one city uncovered, the virus has the opportunity to come back and infect us all, particularly at this time when the mobility of our society globally is so great. 4 million children are now walking normally in the world because of the efforts of you people in the last 14 years. 4 million children. You will eradicate the second disease of this century, the first being smallpox, because of your efforts. And I hope you realize that you as individuals in this room today have the opportunity to influence for the better the health through this program of more individuals than I have had the opportunity to do in my entire practice lifetime. I quote the ancient Greek historian and philosopher Thucydides. I do so because it impresses many people. It continues to astound my wife. But when asked during the long, prolonged Peloponnesian Wars, when indeed will justice come to Athens? And one might ask the same question about polio. When will we eradicate this disease? Thucydides replies as appropriate then as it is now. He said, justice will come only when those who are not injured are as indignant as those who are. It strikes me that the greatest plague we face in the world as we begin this millennium will not be HIV/AIDS. It will not be cancer. It will not be Ebola virus. But it will be the plague of apathy that many of us succumb to because of the ease of staying home and doing nothing. It seems to me that your focus has kept us away from that apathetic root. I finish by reminding you that Sir Edmund Hillary, who was the first to conquer Mount Everest, failed in his first attempt. It was a miserable failure. There was loss of life, loss of equipment. It appeared indeed that the mountain was insurmountable. And he was invited by the London Historical Society to come and relate the events of that failed ascent, not knowing whether he would try again or whether anyone would. And I'm told the setting was one where the single podium and the tall, gaunt Sir Edmund spoke to the crowd in this rather somber, oak-walled room. And behind him, from one wall to the other, was this magnificent color photograph of Mount Everest in all its majesty. During the one-hour presentation, he related all the events of the trip. But when he got to the end, he turned his back to the audience and he raised his fist to the mountain and said, "You have defeated me, but I will defeat you, because you can never be any bigger, but I can." Ladies and gentlemen of the Rotary, because of your efforts, we are all so much bigger. We are all so much ready and have climbed a good part of that mountain. And with your continuing efforts, in a very short time, we will eliminate, as we ascend the summit of that mountain of polio in the world. I and my colleagues are forever in your debt for this effort. Thank you very much.
We have time for one or two quick questions for Dr. McAfee, if anyone has one, and then we're going to have a special wrap-up.
Yes.
Dr. McAfee, I asked you this question just before the meeting. Where are we headed with health care versus government and all those issues in 2 minutes?
We predicted back after the defeat of the Clinton plan that there would be 2 more presidential elections before this was back on the table. I think if there's one thing that I've served on several committees for President Clinton. I have worked with the Attorney General and Secretary, and I have great respect for those individuals. But I will forever be sorry that the President did not allow the other suggestions on the table to occur. And he did not appreciate that all the major players at that time, including the insurance companies, including hospitals, including the doctors and the nurses and other health providers, were ready to sit around the table and craft a new health system for this country. A system which I think is going to have to be built on expansion of the public programs by looking seriously at Medicare reform, incorporating some element of means testing for those who can afford it. You still cannot justify to me why the 25-year-old father of 2 in Portland, Maine must pay for Lee Iacocca's health benefits because he's over the age of 65. And that's what Medicare is today. We've got to correct those problems for those who can afford to pay. At the same time, the Medicaid program has got to be expanded, as we have done in Maine. And I'm so delighted to see our tobacco settlement dollars, much of it, not much, some of it being directed towards an expansion health coverage, not only for children, but for those under 200% of poverty. I'm also very pleased, having chaired the Tobacco Advisory, to point out to you that we have the highest per capita commitment in cessation and prevention for tobacco of any state given the Tobacco Settlement Fund. $22 million of the $55 million we have is going to that this year. By comparison, the state of Connecticut had $300 million. They're going to use 5. The state of Rhode Island is using 1. They thought they were using 1. That's been taken out and put into potholes. New Hampshire has $3 million. California is going to use the money to pay off the suits in Southern California around the Los Angeles area from the police department. We've got $22 million. We have a chance to institute public health reforms in the state of Maine. If we can save the cost of expensive health care through public health initiatives, that will diminish the money. Private sector will still be there, but with the application of new rules under the Patient Protection Act, restoring what I think is the most critical part of the entire healthcare system, the doctor-patient relationship, based on mutual trust and respect for each other, not with an individual in between who represents a financing mechanism, then we will have achieved a good deal towards what we need to go, where we need to go. I'm optimistic it will happen. It will take a little bit of give and take by everyone. I sense that you have the same degree of willingness to sit around that table that you did back in 1992. For those people who don't like our system right now any better than you do.
I can see we need to have Dr. McAfee back on another topic soon. Thank you, Dr. McAfee, for your personal perspectives related to polio. Your experience at the World Health Organization in your hometown of Portland are really eye-opening for those of us who are interested in this topic and are spending our resources as a club locally and internationally. Very, very kind of you with your kind words, and I would say back to you, we are very pleased and honored to be having you as a speaker today in this very important meeting, and with all that you have done. We thank you for the work that you have done in your career. At this time, it's my particular pleasure as an expression of appreciation of our thanks for your making time from a very busy schedule with lots of graduation speeches this week alone. We appreciate the fact you've taken time to speak to Portland Rotary, and I'd like you to know that a donation has been made in your honor toward providing shade trees in the Rotary Grove along the Eastern Prom Trail along the Portland waterfront. It's our expression of appreciation. Thank you for speaking to Portland Rotary. One of the great pleasures of being a club president is the opportunity to work in close association with club members throughout the year and really get to know them. In the case of Rotarians who have been members of the club for a long time, and as a young pup, it's an interesting thing to understand what went on before my 10-year stint in Portland Rotary. And that leads me to a very pleasant duty, and that is I am able to, as president of the club, to recognize one Rotarian each year for dedication and outstanding efforts in the 4 avenues of Rotary service. The award is the 4 Avenues of Service citation, and the very first one this year in this district will be awarded today by District Governor Michael McGovern. So Michael, would you please stand and help me out here? The recipient has been a Rotarian since 1968, being sponsored by Sumner Bernstein. He was president of the club in 1984-1985 and has shown leadership in the 4 avenues of Rotary service: club service, international service, vocational service, and community service. You'll witness today his passion and dedication to improving the world through Rotary service. This time I'd like to ask Barbara Lotfy to come forward to participate in the presentation of the award to her husband, Nash Lotfy.
Thank you very much. This was not supposed to turn out this way.
Well, as a special tribute today to end our meeting, we're going to adjourn the meeting with a musical tribute that will be provided by Nanette Wetmore Mortgage Lending and Peggy Westcott Past Service Fundraising. And this is a tribute to the work of Dr. Sabin, our Paul Harris Fellows, Dr. McAfee, and our 4 Avenues of Service citation recipient Nash Lofty and his wife Barbara. So Nanette and Peggy.
I have to tell you, I haven't been a member very long, but what an honor it is to be a member of this Rotary Club. You know, really to see all the things that have happened, it just brings me, the song that I'm going to sing is Let There Be Peace on Earth. And the first line is, and let it begin with me. And I think everybody, every single person in this room exuberates that statement.
Dakota Street, and I'm going to see if I can capture this rainbow. We seem to have a double rainbow here. It is so brilliant.
Nanette has a group, and we better hurry along here. We've got about 3 minutes, 4 minutes. Tom, get your group ready.
All right. Where are all the people that I asked? You know who you are. I don't want to start naming names. I have a list.
Listen, it's not just me and Julie.
No, it's not.
Yeah, she's here. I talked to her.
Anybody else? If you want to sing. Here you sing.
Tom Churchill. Okay, you're up next. Gather your group quickly because we're just about out of time.
No, this is Tom's. We have one more, but this is the official end of the meeting right now. We just want to say thank you, first of all, to Annette Wetmore for arranging this. Tom, thank you very much. The music committee would gather up here. We'll entertain you as you exit. But Roxanne wants me to remind you that there was a board meeting at the piano. No. Upstairs, I'm sorry. Board meeting upstairs. Okay, come on, music committee. Rock around the clock. Anyone else?
Like a great trip.
Anyone want one more chance? Come on down.